So there are different muscles, we call them muscles of mastication, muscles that you use when you're chewing, when you're yawning, when you're smiling. So we can assess those. Oftentimes there's a component of muscular tension or overuse that we have to treat when we are helping patients who have TMD. So the masseter is one big muscle that arises from the arch of your face and comes down the jaw. That one's often implicated in headaches. There's a big muscle on the side of your head called the temporalis that we can palpate and look, does that reproduce your familiar pain? We can be assessing the joint itself by pressing over the joint, and then I'm going to have you open your mouth and then close, open and close. I'm also looking at, I'm palpating the joint. Is there inflammation in the joint? Is the joint tender to touch? When do I feel any popping or clicking? I'm looking at the normal motions that the joint has to be able to attain when you're chewing or when you're smiling or when you're opening your mouth. We can also look at the movement quality of the mouth opening. So when this patient opens her mouth, I can be looking at the pattern of the opening, can tell me, is there a dysfunction in the jaw? What side of the jaw is there a dysfunction? Does she have a normal amount of opening? We can also be looking at what we call deviation, right and left. We can be looking at protrusion, so jut your lower jaw kind of forward. Good. And then what about lower jaw going out to the right? Good. And then lower jaw going to the left. Good. And then one more time opening. Okay, good. And I'm asking questions of the patient. Is any of that reproducing your familiar pain? I'm looking to determine, are those motions normal? Are those motions telling us anything? Looking at the neck is another huge component. I've had numerous patients where I can bring on the tightness in their jaw by moving their neck. So that's telling me that there's a component of the cervical spine or neck that is contributing to their symptoms. Headaches oftentimes will arise with too much tension in the back of the neck. All too often now we're on our phones or we're on devices and our neck is oriented into a position where we're getting a lot of pressure on the nerves that come in the back of the head. So we're getting headaches that kind of come more in this fashion, tension type headaches. And then obviously assessing too, looking at, the capability of the neck to rotate, the capability of the neck to side bend, capability of the neck to kind of rotate and flex, capability of the neck to, kind of tuck. That's a function more of the upper cervical spine, the upper neck. So all of these little things, we're looking at tightness in the pectoralis muscle. So pectoralis major, if we're rounded here, our head is forward, that puts a lot of tension on the jaw itself. So that's another area where if we see pec tightness, that's a problem. We can also get tension in the muscles of the upper trap. Once again, if I'm pushing on a muscle and it's reproducing that patient's familiar pain, then I know that there's a component of muscular tension that needs to be addressed. We're going to screen the shoulders, we're going to screen the neck, we're going to screen the jaw itself, we're going to screen the thoracic spine, which is kind of the base of the neck down. All of those are areas that often we're going to talk about your stress levels. We're going to talk about what are you doing for your nutrition? How are you sleeping? What are you doing for stress reduction? Are you exercising? We know that research tells us that a combination of hands-on manual therapy and exercise helps patients get better faster. If you're already working with a dentist, I'll be glad to get on the phone with them and have a conversation of the appliance that they've maybe created for you. What is that doing to reduce maybe some of the muscular tension and stress or the malpositioning of the jaw? So it's really a collaborative approach that is best suited to help these patients because, like I said, a lot of them have seen multiple providers already. And if they've seen multiple providers who are just kind of staying in their particular area and they're not communicating with each other, and oftentimes the patient is the one that suffers from that. So we go out of our way to communicate with those other professionals to make sure everybody's on the same page and to make sure that we're doing what's best for you, to get rid of some of these symptoms that can really be quite, they can interfere a lot with your quality of life. They can, the headaches, oftentimes this is affecting women who have kids and are already dealing with a lot of stress with their kids and with their husbands. And, if we can start to equip them with some tools to reduce that stress, reduce that tension, and get them back to being able to be, a mom that is as great as she can be for her kids and for her family, then that's a huge goal for us here. And we've been able to do that with quite a few patients already who are dealing with these TMD issues.